Dr. Aditi Gupta. I'm working as Associate Professor in a medical college in Punjab. Yes, there are many misconceptions regarding the diagnosis of tuberculosis, treatment, and many more. So, first important thing is that many people, although it is a communicable disease, but still it is considered as a taboo in India despite having treatment modalities available. There are patients who are being cured. Still, they are considered as untouchable, and there's a taboo behind those who are diagnosed with tuberculosis. So, this misconception or myth should be corrected, and I would like to tell those who are listening to this video that this disease spreads through droplet infection. So if a patient who has pulmonary TB, if he coughs, then only this disease spreads. It is not by touching or staying together also is a problem if the patient is not wearing a mask. If patient is wearing mask, that too a surgical mask is enough. If he is following all the cough etiquettes, then we can prevent the transmission also, and these patients should not be considered as untouchable. And after treatment also, after 2 months of treatment, those who were positive initially become negative, and in that circumstances, without mask also, these patients are not spreading the disease. So this untouchable thing should be understood, that these patients are the disease which was communicable earlier. With treatment, it becomes non-communicable after sputum conversion. This program, so government is investing a lot in this program, and it is important to understand that the TB elimination which we are targeting is not that easy. Since we have a huge population to cater, it is not easy even despite resources to eliminate the disease. And the most important component of the program which can help us eliminate tuberculosis will be TPT, which is TB preventive therapy. So we should strengthen TPT more and more. Although the coverage of TPT has been widened recently, initially we were giving only to patients who are less than 5 years of age. Currently we are focusing on all the household contacts. So it's important that we should strengthen this TPT therapy. It will prevent the development of disease in the household contacts. So this TPT strengthening is very important. Whatever we are doing under the program should be accessible to everybody across the country, although it is available, but sometimes the medicines are not available on time regularly. So the things should be regular, free flow of all the resources should be available at all the places. As we all know that this disease definitely has a increased incidence if there is overcrowding. So the overcrowded places definitely have more disease, because in a closed environment, the spread of a communicable disease like tuberculosis increases. So overcrowding should be avoided in these patients, but in our country, because of poverty and many more factors, there are at many places there are people who are living together in just one room. In those areas, wearing a surgical mask or doubled up handkerchief can also help. So overcrowding definitely plays an important role. It should be avoided, but in unavoidable circumstances, we can use the proper cough etiquettes, for example, covering the nose properly and not spitting here and there, all these things. And poverty, yes, because poverty further leads to overcrowding, malnutrition. These things also impact the disease burden. So for the patients, the important thing is, first, if you are diagnosed with tuberculosis, it is important that we have treatment available. Government is providing all the treatment for free, and it cures. If you take the treatment regularly, follow up at 2 months and 6 months. If you are taking it regularly, you will be cured of your disease. And regular follow up despite 6 months, despite getting cured, is also important. In case of any side effects, you should visit your nearby government facility or private facility which is comfortable to you. So all the side effects of tubercular treatment are also treatable. The drugs, although they have few side effects, but over the time patient is able to take the treatment properly, then there are very high likelihood that he may not have the disease again and he will be completely cured. So do not stop the treatment in between. Continue it for 6 months or whatever the duration has been told, minimum 6 months. It may be extended also if you require more treatment, if you are advised by your doctor. So do not stop the treatment in between because of the side effects. You should visit your nearby doctor to ensure that your treatment is making improvement in your disease by chest x-ray or whatever examination he feels is right.